Hinsdale. I am Jerry Brooks, and I am one of the co-chairs of the Caregiver Collaborative and also Vice President of Integrated Healthcare here at the Ambassador. And we have a wonderful turnout for our first program for our Caregiver Collaborative for 2019. I want to wish you all a healthy and happy New Year as well. I do want to point out, because we do have a very large crowd here today, that immediately right behind you there is an exit in case there's any need for us to have to meet.
But so we've come a long ways. As a matter of fact, over the Christmas holidays, many of you probably saw a remake of Cinderella. And I thought about seniors and Cinderella. Cinderella's fairy godmother told her to leave the ball before midnight, right? And what happened? She stayed past her time. And her beautiful carriage turned into a pumpkin, and her horses turned into mice, and her beautiful gown turned into rags. This is what's happening to the elderly in our country. They are staying too long at the ball past the midnight hour in terms of current stages of living, in terms of where they're living, in terms of how they're getting about, in terms of who is there, because their children have moved all over the place, to provide some assistance, provide some care. So we decided recently that we would start addressing this issue at all the way down to individual households. We're forming the, Colette came up with the name, the Next Stage Network, preparing for the Next Stage Network.
6 in 10 caregivers report having to make a workplace accommodation as a result of caregiving, such as cutting back on their working hours, taking a leave of absence, receiving a warning about performance or attendance, or such other impacts. Who do you think most of these people are?
Women.
Women. Now, so let's think about this. So now women are providing most of this care traditionally, right? And they might have to abandon their work, right? So they're out of the the workforce. They make less money anyway. And who lives longer? So what will happen in the long run is that women, when they become the age that they need caregiving themselves, are going to be in they're going to be living longer. They're going to have less income because they made less money, but they also probably worked less quarters, right? And they might need more care. And let's see if they find somebody to care for them, because, we just talked about how there's less people to care for. And then more than a third of caregivers reporting high emotional stress from the demands of caregiving, meaning that they need respite desperately. So by supporting family caregivers, we can help people stay at home where they want to be, helping to delay or prevent more costly institutional care and unnecessary hospitalizations, and saving taxpayer dollars. Those hospitalizations get very expensive, which is why so many of the older American Act programs, such as the NORC programs, right, the ISEP program, and are very important. CSE, right, all of those programs, the community, community services,
Community services for the elderly.
Community services for the elderly, right? Sorry. Yeah. So those are so important because number one, they are social based, and they're not they're not a medical model, which is so much more expensive, right? So the aging, the social model is a lot less expensive, and it keeps people on in a social environment, and they're able to stay in their homes. So this is a recent report by the Kaiser Health Foundation. Many people on Medicare incur relatively high out-of-pocket costs for their health care, including premiums, deductibles, cost sharing for Medicare-covered services, as well as spending on services not covered by Medicare, such as long-term services and supports and dental care. The financial burden of health care can be especially large for some beneficiaries particularly those with modest incomes and significant medical needs. Understanding the magnitude of beneficiaries' current spending burden and the extent to which it can be expected to grow over time relative to income provides useful context of assessing the implications of potential changes to Medicare or Medicaid that could shift additional costs onto the older adults and the young people with Medicare. So, basically what's happening, and we've seen congressional reports, the way Medicare and healthcare is changing, they're trying to shift the costs onto the patient, and so that way, and they're trying to do it younger and younger, so that when the younger generation finally gets Medicare, they're used to paying for their own, healthcare costs. But the problem is that without the jobs, and it's not only the jobs, but it's the quality of jobs. People are not getting health care paid for by their employer. People are not getting IRAs. People are not, all of those benefits that they used to rely on in the 1950s, 1960s, right, are not there anymore. So if the cost of health care keeps going up and they expect the patient to and the beneficiary to pay for it, then it's going to put a bigger and much bigger squeeze not only on the senior but on their caregiver, right? Because how many people don't pay for their parents' co-payments or medications or things like that. So in that report, the key findings: 2013 Medicare beneficiaries' out-of-pocket health care spending was 41% of the average per capita Social Security income. So if you're saying, May, that half of the people are living on Social Security, imagine if, as a whole, 41% of that Social Security benefit that comes into a county is being paid to pay for your out-of-pocket costs. So what would somebody have left over for a decent living, independent living in the community? The share increased with age and was higher for women than men, especially among people ages 85 and over. The older old because they have more needs, right? I'm going to go to this one. Half of the beneficiaries in traditional Medicare spent at least 14% of their per capita total income in out-of-pocket cost in 2013. The spending burden was higher for people age 85 and over, in poor health and with modest incomes. More than 1/3, 36% of beneficiaries in traditional Medicare, and half of those with incomes below $20,000 spent at least 20% of their per capita total income and out-of-pocket health care costs in 2013. By 2030, which is right around the corner, more than 4 in 10, 42% traditional Medicare beneficiaries are projected to spend at least 20% of their total income on health care related out-of-pocket costs. So in 2030, Medicare beneficiaries will be paying 20% of their income in health care. Go ahead. So it's no surprise then that this other report shows that bankruptcy filings among baby boomers and elderly are going up. Something that we'd never heard of before, right? And so for example, from 1991 to 2016, the ages in this age group, 65 to 74, went up by 204%. So it may not necessarily be, if you looked at the actual numbers, like, oh, it's not a big number, but the percentage, it means that at this stage in your life, you should not be going into bankruptcy because you can't afford to live. But the problem is that it's going up younger and younger, right? So 55 to 64, right before you're looking into your golden years. Now, let's think about who these people are. Who were, if we look at it historically the last 10 years, who are these people? What happened to these people? They could have been saving all their lives, doing the right thing, being responsible, but what happened in 2008? We had a recession. Many people never recovered from that. So now if we look at what's happening just even today, what was the first question you asked me when I walked in the door, May? Is the Social Security gonna make it through this horrible, political
Shutdown.
system? Yeah. But I was listening to the radio on the way here. Somebody was saying, well, I have a job. I'm not getting paid because I'm a federal worker. I can't get health care because I'm not getting my we're not getting our salary. People in that family had large medical bills or, to be able, and expensive medicine that they were going to need to pay that money to pay for. A shutdown like this, which is on track to be the longest in history, a lot of people are not going to recover from this. It's like what happens when you have labor strikes. You go out on strike for a long time, people don't recover, even if, even when you come back, because it's a very big strain. So I wouldn't be surprised if we looked at this study later down the road and we saw even worse numbers afterwards. But yeah, so this comes out of the Federal Reserve, by the way. This is not, this is an official report that came out. Go ahead. So what does it mean more locally to Westchester County? The New York State Elder Economic Security Index, and this is an average. I'm sure a lot of you are going to say more. But if you have a single person or a couple, right? The average. So they're saying that the average index, which would be for, let's just take a single person who's a renter, $31,272 that they would need to be able to live in the community on an average. So we have their housing for $1,200, $1,276, food for $256, $185. Healthcare. This is assuming that they're in good healthcare. If they need home care and they're paying out of pocket, these numbers can quadruple. And miscellaneous, when we talk about food, we're saying that you're staying at home and eating, you're not going out to a fancy restaurant, right? But anyway, a year it would be $31,272. The average, the average Social Security income, and it's $2,606 per month. The average income, more or less, is like what, $1,600 a year? So the programs that we're talking about, the Older Americans Act, things that come through the New York, the State Office for the Aging, also and this Caregivers Act that we're going to talk about, they are crucial so that people would be able to stay living in their community, right? So that they could get SNAP, which is, with this furlough, it's going to be, they actually passed a bill to be able to continue. But transportation costs, things like that. All of these we need the programs that will be able to keep people living in the community, because if they're just subsisting on their Social Security, they would not be able to make it. Go ahead. So the RAISE Act was enacted and signed by the President January 22nd, 2018. And so this was the final bill that was signed, and it was presented. The Senate and Congress had to have the same identical bill in order for the President to sign. It ended up being that. Go ahead. And the goals of the National Family Caregiving Strategy would identify actions that government, communities, health providers, and employment and others can take to support family caregivers, including person-centered care. These are some of the things that John spoke about. Training for family caregivers, respite options for family caregivers, ways to increase financial security for family caregivers, workplace policies to help family caregivers keep working, collecting and sharing of information about innovative family caregiving models, and assessing federal programs around family caregiving. And addressing disparities and meeting the needs of the diverse caregiving population. So these are all measures that people are going to focus on to see how they will be able to with the goal of making sure that the caregiver themselves is going to be able to be stable so that they could provide a service, the service of caregiving for their parent or grandparent or spouse. Go ahead. So then there was a letter that was written. Many of the national advocacy organizations, including AARP and the Alzheimer's Foundation and many others all over the country, wrote a letter to, I'm sorry. So then what happened was, this is the wrong thing. The ACL, the Administration for Community Living, put out an advisory, so that people could apply to be on this national Family Caregivers Council. And so they put it out on their website, and they had until December 3rd. And I understand that Jerry, are you here? So Jerry has been nominated from this area to be on that council. So right now, they are deliberating whether or not she's going to be on this council. So it's very important. It's very important that we keep that in mind as constituents. You might want to think about wanting to help her along with getting onto that council. But so it's very exciting because if she's on this council, if she makes it onto the council, she'll be with people from all over the country who could be other caregivers, could be other professionals, could be people in government, and so they're looking for a good, well-rounded variety of people to be on this council so that they can then advise and inform policy on what kind of programs would be good for this to happen, for a caregiver incentive program to happen. Go ahead. So nominees will be appointed based on their demonstrated knowledge, qualifications, and members will be appointed for the full life of the advisory council, which will sunset in January 2021. So it's a 3-year commitment because it started last year, but even though they don't have the council. So the council is supposed to advise and come up with a plan until that, and then that will end in 2021, and then from there on, I'm sure they'll have they'll seek more input, but hopefully there'll be a program by then, so that way they could continue. So and then the attached letter. There's another letter in your package. And that was the letter that AARP and everybody sent out. It's June 28th. It's to the Honorable Alex Azar. So you have that. And I thought it was important for you to have that because if you want to advocate further to make sure not only that that Jerry be on this council, but also for more, in the future there might be other things about caregivers that you might want to address. These are good talking points that you could use for your letter. But we're very so in Westchester County and in New York State, you're very lucky, but especially Westchester County, but all of us in New York State. You have Representative Nita Lowey from this district. She, with the new government now, she is the new chair of the Appropriations Committee. That's super important because she is the one that makes sure, she's in charge of the committee that makes sure that whatever appropriations have been made are made responsibly throughout the government. And the legislators last year in November appropriated $300,000 so that the committee that we're talking about, the Family Caregiver Council, is, they have money behind it. There's funding for this to happen. So in any further initiatives that you may want to alert her and your constituents, your super important people, to her so that you can let her know that that this is very important for the well-being of of where she serves and where she's elected. The other one is Senator Kirsten Gillibrand, who is on the Special Committee on Aging, and she's our U.S. Senator, right? So, and I've given you their phone numbers, so that way you don't have to look it up. You can call them directly. And then you can, and voice your opinions. And I think as a group, I'm not here to tell you how to do things or what to do, and I know you have very capable people here, of course. But as a group, you can get together and you can devise a way where you communicate with your elected officials and you talk about the important issues that we've been talking about this morning. The other thing I wanted, and I had some further information on Westchester County, because the thing is that when we go back to the, and we don't have to go back, when we go back to the Elder Security Index, I just wanted to drive home the importance of the work of making sure that people are able to stay in their community. One year we talk about the elder economic security. One year we did economic insufficiency, meaning that how many households 65 and over in New York State were not economically stable. So in New York State, the figure is 58% of households that are led 65% of 65 years and over are not economically sufficient. Westchester County, it's 59%. So, sometimes, and the thing is, we have to really address this, because sometimes we think, you live in Westchester County, you must have money, right? That's the, or you own your house, you should be fine. No. If 59% of people do not have enough resources to be able to live in the community and thrive in the community, that's over half of the people. So we may be looking at people who are not even saying it, right? And that's why it's so important what you're doing with going to every neighborhood, going to every, every church and faith, wherever people congregate. If you're single, a senior who's single, 65 and over, these households, 69%, it goes up, right? Where if it's a couple, 37%, and it makes sense because you have two incomes. Single men, 60% of single men, 65 and over in Westchester County are economically insufficient in their households. 73% of single women. And then if you look at people who are not able to live independently, 65 and over, 73% of women and 57% of men in Westchester County, and overall 68% of people who are not, and that's not of the entire 65 and over population, just the people who do not live well independently, So, so that's why these caregiving, this is very important, because it will provide a resource that will actually let people stay in their homes longer. So if you have any other questions, I think that's it, right? Yeah. You can always reach me, but if you have any questions,
Can you just repeat that statistic? 59% in Westchester of people over 55?
65 households that are led by somebody 65 and over. 65.
59% of those households.
59% in Westchester, yes. And for single women, the same thing, 65 and over in Westchester is 69%. Or single people in general. Couple, yes, single people.
69%.
69% of single 65 and older households. Couples, it's 37%. Single men is 60%. Single women is 73%. And then if you have difficulty with living independently, overall it's 68%. For men, it's 57%. And for women, it's 73%. Any other questions? Comments? No?
My name is Maria Alvarez. I'm the Executive Director of New York Statewide Senior Action Council. And I came here to talk about the importance of the RAISE Act in Congress and to make sure that Jerry is nominated for the committee, the Family Caregiver Committee. We wish her all the luck and we look forward to working with you.
Hi, I'm John Cochran with the New York State Office for Aging. It was a pleasure to be down here in Westchester County at the Ambassador Assisted Living Facility to talk about the caregiving issues and some of the latest trends, as well as to provide some insights in terms of the policies and approaches that we're utilizing at the state level, and we're hoping boils down to local communities to assist caregivers in their difficult roles in dealing with the challenges they face on a day.
Hello, I'm Jana Heyman. I'm with the Fordham University Ravison Center on Aging. I am the Center Executive Director as well as a professor at Fordham University. I also was here today to represent the State Society on Aging and the work we're doing to lead policy reform around caregiving and other aging issues throughout New York State.
Good morning. My name is James O'Neill. I'm the president of BRCA, which is the Bronx Regional Interagency Council on Aging, and a United Nations member of the International Federation on Aging. We're here this morning to discuss a very important topic, caregiving, and in particular the RAISE Caregiver Act, which is being implemented throughout the country. It's very important to me and a lot of others because as we age, we're finding we're living longer and in many cases in better health, but when we do need caregiving in order to remain at home and to continue some type of socialization, we need someone to give us assistance. In the past, it was basically only a professional caregiver that could come into your home and provide the services that you need. Now with acts like this, the RAISE Act, you can actually get the same type of service from a family member or a friend. And that's extremely important because it helps with the socialization process as more and more people stay inside as opposed to going outside for senior services. Thank you, and it's going to be an enjoyable and a very informative morning. Thank you.
My name is Josine Gouchard, and I'm the Director of Health and Wellness Initiatives at the Carter Bird Network. I had the great pleasure of attending today's event, and this special event on the RAISE Act provided by the Westchester County Department of Senior Programs and Services Caregivers Collaborative. And I have to tell you, it was a wonderful event, a lot of great information, some things I was unaware of, and I am just so pleased with all of the effort that has been put forth to bring together all of the different stakeholders here today and helping us to feel empowered so we can go out and advocate more for caregivers, not only in Westchester County, but throughout the state of New York.
Good morning. My name is Reverend Viviana DeCohen. I'm a member of Livable Communities, a caregiver coach. I've been a family caregiver between two family members for 18 plus years. I'm the Director of Military and Veterans Affairs at Concordia College, where many of them are also family caregivers. I was so happy to be here on today to learn information for the many caregivers who have given their time, talent, and resources to caregiving. Thank you.
Good morning. I just want to thank all those who attended our workshop this morning for caregivers. Caregivers are being challenged financially in terms of their physical needs, in terms of their lifestyle quality, and we can't we can't do enough to help them out with this challenging responsibility to keep their family members in the community and in the homes. They are losing income, they're losing their own quality of life and their own lifestyle and their own choices to provide care for their loved ones. So we've got to be there for them. We've got to make sure they know what's available out in the community to help them. We've got particularly some respite. They could go a long ways if they could get a little break themselves in terms of rest, in terms of socialization, in terms of learning opportunities, and we're just glad to be here to help them out.